That's fine. Good morning. Good morning. Good morning. Good morning. Good morning, Corner. How are you? Hope everybody's doing great. I'm doing good. I'm on time today. So a little bit. I'm about 5 minutes late. I ended up getting a phone call. It's one of them telemarketing calls. But anyway, I hope everybody so far has woken up, having a good morning. Day started out good. Got you maybe your workout in, your walk in, your prayer in, whatever you had to get in this morning. Get yourself up going. I hope you're going and moving. And some of y'all just rolled over in bed, probably looking at the phone and the computer. Just going, oh, okay, that's cool too. I'm glad you're here. So today, couple things. So please, 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 it is on top of the link. It's here. Please do not forget tonight. Tonight, baby, is No Child Mental Health Left Behind. Tonight we are talking with Tori and Jerron. We're going to talk about the health of our children and their mental health and everything that's gone on really since March, how it's affected our kids over the course of these past 4 or 5 months since everything's been happening. It's a conversation that must be had that we really need to talk about. And although it's going to be me, Jerron, and Tori on the panel, I want everybody to be there. So on there, you'll see the link. Join us on Zoom. I'm going to, yes, live stream this through Facebook, but here's the thing. I need to hear from everybody. I need everybody to participate because, listen, I'm not the only one. I'm not the only mama. I'm not the only, there's not just one daddy. We got mamas, daddies, aunties, cousins, you name it. We even have young adults here, people that are also, that went through school, everything. All this stuff has affected our kids and affected us even one way or another, and it needs to be a conversation that is long overdue, that we really, really, really must have. So I'm asking parents, I'm asking children, I'm asking all of y'all, 6 o'clock, power out on the computer, whatever you got to do, laptop, whatever it is, register, join the conversation. I'm going to want to hear your questions, I want to hear your input, I want to hear all of that. Tonight, 6 o'clock, make sure you register. It's going to be great. I'm excited about it. We had a great little powwow yesterday and I'm already just excited for what's about to go down. So that's that. Now, today, I said, okay, y'all know about the video with Dr. Stella Emanuel. Dr. Stella Emanuel is a doctor who is in Houston, Texas, good old Texas. And it said, don't mess with Texas. I got family from Texas. I know better. I'm going to just go here with it. So she claims she has the cure. She's been treating about She's treated 365 people and counting, per her words, um, for this illness, for COVID-19. With Now, I'm gonna be real with y'all. When it comes to pronouncing certain medications, I'm really not good, so y'all bear with me. Hydrochlor, hydrochloroquine, chlorine, whatever, and arthromycin. Arthromycin. I told y'all I'm bad pronouncing names, but anywho, is these three medications. I'm gonna post them. But I went ahead and I said, okay, I'm gonna look them up. We're gonna go ahead. Now, one of them I know is the chloroquine. That's used for those who have lupus. I watched a little mini video. Obviously, a lot of stuff that's put together is put by people who are for it. I recognize that. There are things that are put together for people put pro, con, and you have to decipher what's truth and what's not. Okay, so let's just be 100 about that. So let's go with what hydrochlor, the first one is. So, if you guys remember back in March when this all first started, in April, the administration, our current administration, um, especially Donald Trump, was like, oh yeah, we've seen this, and they were talking about people are taking this medicine, they're feeling better, so on and so forth. Now, here's the other part. This is where I'm kind of like, everybody's like, we got a cure, we got a cure. Grant you, these medications may work. Okay, let's keep it 100. They may work. They may not cause any issues. Let's keep an open mind here. Here's the problem. All of us have different types of our each of us our bodies react different. Okay, so I could take an antibiotic, for instance, and I'll be perfectly fine. But I could have a best friend of mine who could take an antibiotic or one of these medications, and they have a totally different response to it. So we've had them, a lot of our scientists, a lot of people who put out the prescriptions and things like that. They said we have to go through the clinical process. So the clinical process usually could take 6 months to a year, sometimes 2 or 3. It just depends. Um, and in that, you have people. They taste animals. They have people that participate in the clinical trials a lot of times. And when people participate, that's a risk that people are taking. So, but the first one I want to tell you, so this is me looking this up. So y'all know I'm not playing. I don't know if y'all can see, probably not. Okay, hold up. Oh well, whatever. But this is the first prescription, okay? So it's a immunosuppressive drug and an anti-parasite. It can treat and prevent malaria. It can also treat lupus and arthritis. So it has different purposes, obviously. Um, no prescription is needed to take it. It's no known risk to pregnancies. Okay, so let's go with side effects to this particular hydrochlorine. May cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. So one is a headache, dizziness, loss of appetite, nausea, diarrhea, stomach ache, vomiting, rash. Okay, that's just a few. Another one. Here we go. A seizure, yellowing of your eyes, ringing in your ears or trouble hearing, unusual mood swings, or unusual mood changes, correct me. Severe muscle weakness, loss of coordination, underactive reflexes. Let's keep going. I'm just telling y'all some of these side effects, okay? That's just a few, okay? As I was reading too, it was saying, here's another one. To make sure hydrochlorine is safe for you, tell your doctor if you ever had vision change or damage to your retina caused by anti-malaria medication, heart disease, hyperthermia, diabetes, a stomach disorder, an allergy, liver or kidney disease, psoriasis, alcoholism, a genetic enzyme disorder that causes symptoms of affecting the skin or nervous system, a genetic enzyme deficiency called glucose 6 phosphate dehydro. I don't know what that says. Okay, deficiency. Medical terms. I told you I'm not good with it. I'm gonna just keep it 100. I'm not gonna front with you. But basically, these are the things this thing's supposed to help treat. Now that's just one medication. Now let's go with the other one. Let's look that up real quick. Now, azithromycin, whatever. So it's called ZMac or Z-Pack. Common brands are the ones. It can treat various types of infections, including pink eye. Okay, cool. So some of us have probably already used it for whatever reason. So same thing, prescription needed. Common side effects: diarrhea, nausea, abdominal belly pain, vomiting, and headache. So a lot of this you're gonna get a headache from. A lot of this you might go to the bathroom quite a bit. You're gonna poop out all your business. Okay? These are just some of the side effects. Let's go. I'm going to keep going because I want to see some more stuff here. Some of this I'm like, wait a minute. Important warnings regarding this second drug that she's telling y'all need to take to cure COVID. Abnormal hearthythmia warning. In some people, some, not all of y'all, some of y'all, in some people, azithromycin may cause an abnormal heart rhythm called QT prolongation. The risk of this condition is increased if you already have certain problems with your heart rhythm, or if you take any drugs that may also cause QT prolongation. I'm gonna just stop right there. Hold up. Now, if I go back to her video, she said she used one, two. I'm already just talked two of these drugs for people that have underlying conditions, but it cured their COVID-19 and they're doing fine. Okay, great. But these are people that have underlying conditions. So she mentioned diabetes, and we just read this called diabetes, this causes all these other issues. I ain't done with the rest. There's one more we got to read. Heart rhythmia. This could cause. I'm not doing heart rhythmia. The other one, you got issues with your liver. You have an issue. I'm not feeling. Hold on, we ain't done yet. Same drug, second drug. So you're gonna give me two drugs that could cause the issue with my liver. My liver, your liver. Okay. Your liver is your filter system. Part of your filter. It cleans out all the crap. Okay, you got your kidneys, help you pee, all that other good stuff. But your liver, you got to keep that thing right because it helps get rid of the junk in your body. But it's gonna cause liver problems. Hmm. Hold on, I ain't done yet. So it's used to treat bacteria. Okay, common side effects. Here we go. Diarrhea. You're gonna be in the bathroom, honey. Nausea. Mm. Abdominal belly pain. You might as well just hug on to that toilet because you're gonna be vomiting, and on top of that, have a headache. So I'm gonna either be pooping, throwing it, holding my belly and my head all at the same time. Mm. Oh, okay. Let me go with the sear. Those are just minor side effects, mind you. Now, all of us have had a stomach ache. All of us had to go diarrhea. We've all had an L. We've had the ones I just mentioned. Those are minor. Here's the serious ones. We already said liver problem. QT prolongation, heart rhythmia, allergic reactions. Okay, that's diarrhea that cause diarrhea that caused by bacteria called C. difficile. I don't know what that is, and I'll look that up too. But that's the reason why you have it's a bacteria in your body causing you to have fever, abdominal pain, nausea, and reduced appetite, and cause you to go to the bathroom and have stomach pain. That's a side effect. Hmm. Those are the serious ones. So in other words, my heart could have start acting funny. The liver, which is supposed to clean me out and filter my system, I may have a problem with that, and I may have a bacteria. It could cause to have me a bacteria that could make me go to the bathroom because I got diarrhea, my stomach hurt, nauseous, and I'm vomiting, and I got a headache. These are some of the side effects. Let's go. Let's go with the last medication. The lady gave about three. We're gonna go now with chlorine. Oh, what's it? Chloroquine. I told y'all I don't pronounce this stuff right, so forgive me. So this one is also an immunosuppressive drug, anti-parasite, can treat and prevent malaria. It can also treat extra-intestinal biases, a liver infection. Okay, so wait a minute. You're giving me two medications that are treated for malaria that could cause all these, but they could give me nauseous, they could give me diarrhea, they could cause me to vomit. But one of the other side effects is that it could give me a liver problem. But here's a drug that could treat a liver infection. Okay, all right. So maybe you got a backup plan. Let's go with that. Okay, let's go. Let's go with that. Let's see what this is. It's used to treat malaria, liver. It's also used to treat liver infection. Okay, so y'all could probably get my liver back right if it acts up from the other two medications that you done. Okay, let's see. All right, so we're gonna keep going, and they're saying it should only be used in the hospital for COVID-19. Okay, so using these medications. Here we go. Using this medication with any of the following medicines is not recommended. Hold up. So now these three medicines supposed to make me feel better. But here it is, it tells me these are three medications that somebody could possibly be on and I can't. Mm. Okay, and these are a list of medicines you could take that your doctor could change. Okay, so I got a whole list of medicines. Okay, so the number of medicines that you could take is greater than the ones you can't. Okay, so this will tell me all the proper usage and everything. Of course, you need to use it in a hospital. So this is what they're supposed to do. So here's some of the side effects with this last one. Along with needed effects, the medicine may cause some unwanted effects. Although not all these side effects may occur, they do occur. They may need medical attention. Check your doctor immediately if any of the. Okay, here we go. So, anxiety, attempts at killing oneself, back, leg, or stomach pains, bacterial stools, bleeding gums. Oh, I'm not good. This is getting good. Cough, confusion. I get confused already. I don't need nothing to help me. Dark urine, difficulty with speaking, difficulty with swallowing, disturbed color perception, dizziness, faintness, lightheadedness, getting up suddenly from lying or sitting down position, double vision. This is just a few. They got a whole list of stuff, y'all. Y'all better look this stuff up. Large hive-like swelling on the face, eyelids, lips, tongue, throat, hands, legs, feet, or sex organs. Hold up. I don't have enough on my face and on my business. Okay. Yeah, y'all really pale skin. Y'all see I'm yellow, right? Pale skin. I need all the melons I could get. Okay, okay, so that's some of them. That's just some of okay, let's go here. I want to go find some more. Let's go find some other ones. Blurred vision. We already said that. Nausea, vomiting. Here we go with that abdominal stomach cramps, headache, diarrhea. I'ma lose my hair. Temporary hair loss. Change in hair color or muscle weakness. Here are the serious ones though. You know, earlier you remember it said you might kill yourself. But here's the serious ones now. Mental or mood changes, such as confusion, personality changes, unusual thoughts, behavior, or depression. Now, I'm gonna talk. I, okay. Hearing changes, darkening of skin or tissue inside the mouth, worsening of skin condition, sun sensitivity, signs of serious. Okay, I'm done. So here's the deal. So I know I took a lot of time, but here this woman came telling me these are the cures for COVID. So I read all the side effects. Here's my issue. Do I think there's a cure for this thing? Absolutely. But these are all medications that I do know. One, like I said, I know for certain the first one is used for lupus because I know some people who have lupus who have and some that are probably currently taking that medication. So first of all, some of these medications some people are already using for illnesses they already have. One point of one of the videos and one of the things I read last night was that when people take the need for these medications for illnesses and treatments that people are already receiving for illnesses they already have, because of the demand for a cure for this thing, is now affecting other people. Number one. Number two, I'm more concerned about the side effects. If we haven't paid attention, and I don't think a lot of us have, people who are getting treated and possibly getting treated with these medications are coming out with some of these side effects, are having issues after the fact. But y'all want to give me a vaccine, you want to give me all these drugs, and she's coming out, I got a cure for you. But some of this stuff could cause the side effects. Those are my concerns, my very big concerns. How is it that you have me, you claim a cure, you want me to do this treatment, but yet it has all these liver problems? I'm gonna give you an example, and I'm going away from COVID-19, but personal here. Y'all know I'll go personal. My mama, my mother, was diagnosed with stage 4 pancreatic cancer back in December of 2017. Now, they gave her pain medications, they gave her different medications to help her with pain. My sister and I were trying to find ways of natural, and she did so much, but at the end, she ended up sticking with the medication. Yeah. First and foremost, chemo, as y'all well know, chemo they said will kill, chemo, radiation, all that. They said it'll kill the cancer, but it kills the healthy cells too. It kills and it does it at the same time. Now, at the same time, it was probably killing the cancer cells and damaging her healthy ones that she could recover. They were giving her medication that was damaging and hurting her liver. And it was a pain medication. She didn't feel pain. She had stage 4, meaning that the cancer that my mom had in her pancreas had already spread it to her liver, had already spread it to different parts of her body on the inside. But you're giving her this medication that's causing where her liver is supposed to filter out all that chemo, where her liver is supposed to filter out all that stuff. Here we are, COVID 19. You want to give me three medications, two of them that have liver problems, one of them they have heart problems. People, and they're saying, well, if people have an underlying conditions, okay, people may have conditions they don't know about. They're walking, possibly walking away with conditions they didn't have before COVID 19. But they're cured. They don't have COVID 19 no more. But now you may have to be on this medication for the rest of your life. Oh, you may need a heart transplant. Oh, your liver is going to be jacked up for the rest of your life. You may need this for what the heck? Really? But give me all these medications so I don't have COVID 19. I'm supposed to be good with that. This lady came on and she said, well, I treated 365 people and they're doing fine. I'm curious to how they're doing for real. I'm very curious. And then here's the interesting part. When I went back, they're taking the video down because it's saying it's false information. Here's why they're saying that too. The other part of that is people have to go through what they call the clinical trial. If you've done any, went through any psychology classes, any type of health related classes, which some of us took in college, or sometimes if you had to do a paper, you have to go read these different clinical trials. I remember when taking psychology for a time period, I had to read different clinical trials and form my thesis and all these other things. But I had to pull several cases together to come with whatever to support my theory. You come with the theory, is have to find the steps to the cure, right? Yes, a lot of people have gotten this thing. A lot of people have recovered. So that, like I said it before, that's a good thing. However, there have been people that have died. And then there are those that have died that may not even die from this thing, but unfortunately, that's a whole other story. But there are people that have died from this thing. And with that being said, we want to give people medication that can cause people to have further problems that now they're going to be on medication, other healthcare issues that they could possibly be facing down the line because of COVID 19. For those who don't know, I sell life insurance. Life insurance is not covering people who have COVID 19 after that. I'm not saying those who died, but if people who are diagnosed with it and recover, when you go apply for life insurance, you don't qualify because you had a pre-existing condition. Wait, what? So that's now, we were at 4 million people that have recovered. That's 4 million people that will now be able to have life insurance. So if they don't have investments and certain things in place already for their family for when their time comes, take care of their family. Because now COVID 19 is considered a pre existing condition. You want to think about that. All these, and then think about this when you go apply for something like life insurance, there are questions that are asked. What kind of issues do you have? Well, here's the deal. I just told you have liver problems, heart problems, abdominal pain, diarrhea. You now put yourself on a list where you could possibly have all these other ailments. This is part of why COVID-19, number one. They don't know so how to cure it. They really don't. Then number two, the medications that can cause long-term effects on people. This is why you can't. We're now looking at a whole nother issue: prolonged effects for people. You think the healthcare system's jacked up now? Watch what's gonna happen. I say it now. Watch. If people don't have their stuff in order now or not trying to watch, there were truly precautions that could have been taken at the earlier stages of this. This has been seen. This illnesses like this don't happen overnight. They happen over a period of time. And when the first early signs of this thing was happening, there were things that they could have done, and all these clinical could have done. But now, because it's so massive now, okay, now we got to do something. No, you should have probably been doing figuring out something a long time ago. But now you want to give medication that can cause other issues that other people that are taking for other problems they already exist, such as lupus, such as malaria, such as whatever other issues these people are dealing with, that people are taking these medications for. Now I'm trying to go ahead and spread it on a massive scale. But yet these people that I'm perfectly. Only issue with me is I know I'm overweight, but there are people perfectly healthy, perfectly fine, got COVID-19, came in, come out, and now they got all these issues after the fact. They're not going to talk to y'all about that. How about that one? So, and here was the other one. Did y'all hear me tell you that one of the medications will possibly cause you to want to kill yourself? You gonna have mental issues, depression, anxiety. Hold up. I already deal with enough stuff. You trying to tell me one of these might cause? So it's not just physical; it's up here too. Basically, it could jack me up literally from head to toe. But I'm supposed to let y'all treat me with all this meds, all this stuff, because you say it's secure. Just because this woman done got on there and said this. President Trump, they've been saying it helps certain people, and I'm sure, and I guarantee, I'm certain there's some people that took all these medications because they have this perfectly fine, ain't got no issues, great. But not all of us are the same, and that's the whole point of them saying we have to run clinical trials. That's the whole point of saying we need to make sure this is the right thing, because with any sort of medication, nothing. I like what one woman said very clearly: there's nothing that's 100%. That there's something we could try. The whole point is they could want to try something to see if it's going to be to minimize as many side effects, as much backlash as possible, because there could be a massive backlash from this if you just dope everybody with the exact same thing. Think about the massive amount. You got people walking around here really killing themselves. People walking around here with mental issues, liver, heart, and you already there's already a massive problem with people having liver issues, people having heart, probably need transplants. There's already a weight on. Now you done just created a bigger, massive problem just because you need a cure. So I don't know what to tell you. I read more about Dr. Stella. Now, what I read was not good. How much of it I believe, I don't know. And here's why: is because I know people say things and people put things out there to defame someone's character. What I did read was they were saying that she's very kind of pretty much trying to put her out there like she's crazy. She's extreme. Now there were some things they were talking about where she was saying she sees demons and so on and so forth. You have to understand There's certain things that were said that I read. I was like, okay, maybe she did experience these things. Uh, y'all know where I stand, spiritual, all that. Y'all get. There are things I know people see and experience, and that even my own self has experienced to a degree, not to as much as I know some others have. But there are things I know and I'm aware that happens in the spiritual realm that not everybody else. Some people are like that's crazy, but if you actually see and experience, you'll probably go, "Oh my God, that's real." Yes, it's real. It's not a hallucination. It's real. But that's a whole nother topic. But anyway, they were basically trying to make her out like she does extreme practices, like she does really extreme things, and she says things that are very extreme. Sometimes you do need an extreme thinker. However, I'm sure she's very well educated and very. She seems like she, in the way she knows some stuff, but I would like for someone like her to use a little more wisdom because she's used this thing on 360 some people. I would it would be good if somebody went back to look at those 360 some people to make sure, like, come on. I would like her to use a little more wisdom, a little better judgment on something instead of just this is the cure, this is what you need, y'all don't need it, and I give my people this. Wait a minute. The way she came at it, I don't think was good. The way she came about it was not good. As a doctor, as a scientist, I would hope and think I would hope she would use just a little more wisdom, right? But the urgency I recognize is there too. The urgency to get a cure, urgency to for everyone to get to so called back to normal, whatever that will be after all this. Because honestly, when you go through something like this, there's normal is not is going to be different. Our normalcy is going to change. Period. Because you can't go through something like this and expect to go the same way you were before. It changes you. But I would hope that we use a little more wisdom and knowledge, and we lack so much of it. We do these things to push our own agenda, to push a major necessity that's not truly required. So I would rather, personally, I want people to find the cure and understand the urgency of finding the cure, but really find something that's going to work. And even and let's try to minimize the backlash because if anything with any medicine, anything that we use, there can be a backlash because there's side effects to everything. The side effects, as they said to this, concern me because those are alarming side effects to me. And when you hear people that are going through this thing that come out with issues after the fact, they are now having other issues coming down the line. And if you don't believe me, go look it up. In fact, I'll send it to you. People are having other issues going down the line. And it's not just people with already underlying issues. People who probably already had underlying issues may have bigger issues now. People who didn't have issues before may have issues now. Things that we can prevent. I've explained just even with my own son. I do not want to send Mari to school. I'd rather for Mari to go to school here at home, be online, distant learning. Hello, talk to the teacher, go through that process. Me and him do what we got to do to make sure he's getting his, and we all working together as a team until they can figure it out why my son has certain issues. My son has seizure. I've seen all of us, not all of us, a good portion of us who know what seizures are. We've lived with them. We've either experienced somebody we love and care about. I've watched Amari experience seizures. You will never know. I'm gonna go personal here because today we're gonna talk about the kids, so I'm gonna get real personal. As a mother, feeling helpless, feeling very helpless, so when your kid is going through something like that, and you can't do nothing about it, but just try to be the support you can while he's going through it. I'm gonna put it like this: with Mari's seizures, Mari still talk to me sometimes when he's having them. Okay, so you cannot imagine being a mother and your son's trying to talk to you, and he's saying, "Mommy, make it stop, make it stop, make it stop" during the seizure. You would not know what it's like when he's saying, "Mommy, I feel it coming." And then he's looking and his eyes are bulging out, his tongue is coming out, and there's nothing you can do but let him go through that process. And you wanted to hurry up and end, but he's got to go through it. And you hope you happy for the short ones, but when the long ones come, it's like agony and pain because there's nothing you can do about that. So let them go through. And then there comes the concern that, oh my God, these things could be damaging to his brain. But y'all want us to dope these people, and that's a child. But let's dope these people up with all this medication. People with lupus have certain issues they have to deal with. They have to find what medications work for them. This particular medication may not, because they may have certain issues they deal with now. I have an aunt who has lupus. I know there were different medications she had to take countless times because she ended up having certain side effects, certain issues after the fact as a reaction to certain medications. Getting treated for her illness with some of these medications we talk about, but she has some side effects. I'm sharing these things so you guys don't be stupid. Don't fall for the educate yourself. The one thing I have heard and I will tell you, I will agree with is build up your immune system. Get you right. Get your body right. Get yourself more in order. Take your vitamins, all that good stuff. You hear me? But what I would want these people to do, yes, understand the sense of urgency to get the illness cured, to find a way. But we also know, let's keep it 100. Here in America, we don't do cures. We just go ahead and put a band aid on it so we can make some money. Keep that 100 too. But it would be nice if y'all find a cure instead of putting another band aid on something else. It would be nice. I don't know if I'm going to do it, but it would be nice. Anyway, that's my little 2 cents, my spiel for today. I've talked about it because it needed to be addressed. And again, that's part of what we're going to talk about tonight on another end. But these medications are not things that I would want to jump on because of the things that can happen. And if I were you, I would go look up people who take these medications and find out what side effects they're dealing with because, like I said, these medications are to treat certain illnesses. But I would want to see what people are dealing with that are there already taking these medications. What are they dealing with? And now you want me to put this in my body? This is my temple. You want me to fill it with something that could hurt me? But we supposed to be able to take these things and think it's all good because hey, we just need the urgency of needing a cure, the urgency of wanting to get out there. Well, there's my urgency. Yes, I get the urgency, but my life is more fragile. My life is more important. So the urgency of me living and being healthy and having a sound mind and not having all these other issues is more important than taking your medications and finding a cure to go ahead and appease the masses. So, anyway, I'm done. I really do hope to see all of you tonight, 6 o'clock. Please register. The link is available. I'll post it again later on today for those who have not seen it. But I do need you to register. You can register all the way up to right before um, to enter the conversation tonight. We are going to talk about it is called No Child Mental Health Left Behind. We need to talk about, as I started the video, and I'm going to start and say this for the final time tonight before I go on tonight. We need to talk about what's going on with these babies. Maybe Mario come and tell y'all some stuff, how he feels, because he's had some stuff issues with some of this. He gets frustrated. And I have a child with special needs. So just imagine. There's some things that could be a little harder than this. And hey, when you have an active kid, have a kid ready to go and do some stuff, there's some issues. But anyway, tune in tonight. I really would love to hear everybody's opinion. Have questions. Have your thoughts. Share your thoughts. Share this video. I want to hear your opinion. I want to hear your feedback. Do y'all agree with Dr. Emmanuel? I think we should go ahead and just say, or do you think there should be true clinical studies and a real cure and a real plan to execute? Should these, here's my question. Should there be a process that we go through where people can get real medicine that can help them and cure them and minimize the side effects and the backlash? Because, like I said, all of our bodies are different, so we act differently. I could take medication that'll be fine for me, but there could be the next man or woman that could take something, and because they're more sensitive or whatever else is going, they may have an issue they didn't know about. It happens. Medicine is a game. Medicine, science is a hit or miss, baby. How many are we gonna hit and how many we gonna miss? What is really gonna happen? You tell me your thoughts, your feedback. Tell me what you think and feel. You have questions, you want to call, text me, whatever. My number's out there, 562-526-2966. Email me, inbox me. Whatever you got to do, let me know. You guys be blessed. Again, let me tell you something though. You guys are still amazing. You are still wonderful. You are still awesome. And I definitely look forward to hearing from everybody and seeing everybody this evening, 6 o'clock on the dot. All right. Be blessed. Take care. And good afternoon. Have a good afternoon.